How Autism Impacts Mental Health by Timothy Rohr. Autism is a mental and developmental disability that affects someone's communication skills, understanding social cues, behavior, and sensing things around them. Autism can even affect the way someone learns. Autism is a spectrum. Not all individuals with autism are the same. Some people with autism have a strength in science and math, while they have a weakness in making new friends. For other individuals with autism, it's vice versa. We're going to learn more examples on how autism impacts mental health. Since autism affects individuals' communication skills, they may talk differently than someone without autism. An individual with autism may be nonverbal. Some individuals with autism may be verbal, but they have difficulty starting a conversation on their own. Some individuals with autism may find it easy to start conversations on their own because they like to talk about their interests repetitively or talk about interests that are unique to them. Since autism affects communication in those following ways, people without autism may lack the knowledge to understand that those are actually symptoms of autism and not just quirks. Therefore, people without autism would stereotype individuals with autism and stigmatize them from society. People without autism may socially exclude individuals with autism in various ways, such as ignoring them, not inviting them to sit at a lunch table with a group of friends, patronizing them, or speaking to them in a phony manner, and individuals with autism listening to their peers' conversations without being invited to say anything. Some people without autism choose to bully individuals with autism. Individuals with autism struggle with their mental health due to being treated differently in those following ways. Since individuals with autism may struggle with their mental health, they will face negative emotions such as sadness, depression, and anger. In addition, it may trigger bad behavior, trigger meltdowns, cause them to have trouble sleeping, and not wanting to go to school or do work. Since people without autism stereotype and stigmatize individuals with autism, individuals with autism would choose to avoid interacting with people without autism and only feel comfortable interacting with other people on the autism spectrum. Even though people without autism may stereotype and stigmatize individuals with autism, there are people without autism who are familiar about the symptoms individuals with autism face. However, they may only socially include people with autism with limits. Someone without autism may include an individual with autism to eat lunch together in the school cafeteria, say hello to each other in the hallways at school, and stand up for the individual with autism when they're being bullied. However, someone without autism is not interested in inviting an individual with autism to hang out at places outside of school or work functions. If the individual with autism is lucky, someone without autism may exchange phone numbers or other contact information with them. While they may exchange contact information together, they still do not hang out together at places outside of school or work functions. An individual with autism would feel happy when they see someone without autism in school or at work, or even through virtual communications if they're lucky. But the individual with autism struggles with their mental health when they're not at school or work because someone without autism chooses not to hang out with them. Just because people with autism may have symptoms that make them different, it does not mean we should treat them differently. People with autism have feelings and can struggle with their mental health just like anyone else. While it's certainly better to socially include people with autism with limits than to stereotype or stigmatize them, people with autism would feel happy about their mental health if you socially include them to the fullest by hanging out with them at places such as restaurants, movie theaters, beaches, and by inviting them to parties in addition to seeing them at school or work and having each other's contact information. Understanding people with autism and their mental health makes them feel accepted and included. Please subscribe to my YouTube channel, Tips for Inclusion, the number 4. Check out my other videos and share my videos with your friends, family, and everyone around you. Check out my website and social media